Welcome, and thank you for that warm applause. Thank you very much. And thank you at home for watching. Now today we're talking about vitamin D deficiency, a disorder that puts 50% of the global population at risk. Now over time, we've shifted from working in the fields to entering into the industrial world. Now due to these lifestyle changes, people just don't get as much sun exposure as they did in the past, and our vitamin D sources in the diet are minimal. Now, although many sources for the vitamin are natural, vitamin D deficiency is soaring in the U.S. About 3/4 of teens and adults are deficient in the so-called sunshine vitamin. There are two main types of vitamin D. Vitamin D2 is obtained from sources like mushrooms and alfalfa, and vitamin D3 is produced when skin is exposed to sunlight. Now, vitamin D3 is also available in fatty fishes, eggs, and beef liver. Now, many people don't have enough levels of vitamin D because of limited exposure to sunlight and strict vegan or vegetarian diets. Natural aging is also a cause of vitamin D deficiency because bodies slowly lose the ability to mobilize vitamin D, and over time, especially in postmenopausal women. Now, other risk factors for vitamin D deficiency include obesity and diseases that don't easily convert or absorb vitamin D, such as Crohn's disease, cystic fibrosis, and celiac disease. Now, the short-term symptoms with vitamin D deficiency can be very subtle and mistaken for other medical conditions. It's important to see a doctor to see if you have bone and muscle weakness, a deteriorated immune system, or depression. Now, multiple long-term symptoms consist of dental problems. You even have cancer, diabetes, osteoporosis, cardiovascular disease, and asthma. It's a lot of symptoms. Now, fortunately, a simple blood test is all you need for an accurate diagnosis. It measures how much vitamin D there is in the body. If recommended by a doctor, X-rays can also be used to diagnose the bone abnormalities associated with vitamin D deficiency. Now, based on the levels of vitamin D in the blood, a doctor recommends a course of replacement therapy. Now, whether it's eating more vitamin D-rich food, taking supplements, or spending a safe amount of time in the sun. Now, it's important to ask a doctor about a personal treatment plan because too much vitamin D can be toxic. Now, there are numerous ways to prevent vitamin D deficiency, and the best combination of these options really depends on your age, where you live, and the nutrition status that you have. Now, with this in mind, the following steps can be recommended to balance the levels of vitamin D in the body. Limited sun exposure, a well-balanced diet including vitamin D-rich foods, vitamin supplements, and exercise. I live and practice in Detroit, and I believe our city and the people that live here represent the best of America. I wanted to create a place that folks can go to that not only delivers health information, but also helps us share inspirational stories to help all of us grow, with real problems discussed in depth with real solutions. You are the most important person to the patient. This is Ask Dr. Nandi.
I was having a lot of aching in my legs, as well as pain in my joints. As I would sit, I thought it was just from sitting at the computer a lot or sitting in my bed with my legs straight out working on the computer, but it was something else that was wrong.
Welcome back. We now have Catrina Hurst. Catrina, thank you very much for joining us.
Thank you for having me.
Oh, no problem. You know, before we talk about vitamin D, you tell us a little bit about who you are.
Sure. I'm an entrepreneur from Detroit.
Oh, great.
I've been married for 12 years, and we have a wonderful 10-year-old son.
Awesome. What kind of entrepreneur are you?
I own a daycare school and a modeling school in Detroit. Yes.
Well, that's great. That's great. Well, what vitamin D? Now, when did you first, think or suspect any symptoms that you have with vitamin D? Now, this is before you were diagnosed. What symptoms, now looking back, would you say when you first had?
My first symptoms were I was having a lot of aching in my legs, as well as pain in my joints. As I would sit, I thought it was just from sitting at the computer a lot or sitting in my bed with my legs straight out working on the computer, but it was something else that was wrong.
And so the joint pains were there all the time?
It was mainly at night. I couldn't sleep. The pain would wake me up at night. And then muscle spasms started in my other leg.
And then what did you do? Did you go see the doctor, or?
It was almost time for an annual So I just decided to write down my list because every time you get to the doctor, you forget what you want to ask the doctor.
It's very important.
Yeah, so I wrote down my list, and the first thing I told her was, hey, there's something wrong with both my legs. So
and you went there. Very important point. This is not about vitamin D, but in general, when you go see the doctor, you could have a litany of 50 things to talk about, and what happens is invariably then you lose your main focus. So I'd recommend writing down maybe 3 at the 4, at the top 4 things to talk about, so you get very focused on it. And then so you went to the doctor with this 3 list, and you said with a list of 3 things, and said, I've got this joint pains and aches, and what did the doctor say?
With a history of breast cancer in my family, as well as multiple sclerosis in my dad's family, she started to rule out certain things. But when I told her the pain was really bad, she immediately wanted to do a test.
Okay. Yeah, and what did she do? What did she test for?
She drew blood.
Yeah.
And she informed me the next day that my vitamin D was very low. It was almost below 15. It was between 10 and 15. It was very low, and it should be over 30.
Okay.
So I knew something was wrong.
Testing was pretty simple, wasn't it?
Yes, it was very simple. Well, simple for some. I'm not good with needles.
Yeah. A lot of people are not. You're right.
So when they're in there trying to get my blood, I'm about to pass out.
My sister's like that.
Yes.
Give a needle and it's over. Yeah.
Yeah. So they finally got the blood.
Yeah.
And they sent it out for testing, and then they came back, the next day with the results and gave me a call. Pretty
good. So for those of you who are thinking that it's really hard to diagnose it, and if you have a good doctor, and it's a very simple test. Yeah. And so you got tested and you were told vitamin D was deficient. What did you think? I mean, did it surprise you? What did you think?
It surprised me a lot because I'm always outside with the kids at the daycare.
Yeah.
I'm in the sun a lot, and I exercise regularly. So I didn't know why I would have an issue with that. But I am lactose intolerant.
Okay.
So I can eat a bowl of cereal, but I can't drink a glass of milk.
Okay. Can you have yogurt or other
Yes.
things? And you or not very much?
Not really. Not my favorite. No.
All right, I understand that. So, so you were surprised. She said, I'm in the sun a lot, because remember we talked about in the beginning of the show that you can get certain kinds of vitamin D3 that can in your skin, you can convert it into vitamin D3 if you have sunlight. So you were surprised. What did the doctor say when you said that? I'm in the sun all the time?
She told me, because I'm African American, because of my skin, it's dark, that my skin just may not take it, and it's different for each person, as well as I can't eat red meat. The beef and a lot of things, it irritates my stomach as well. But like I say, everything else that I was doing, I thought I was doing enough of, but it wasn't.
It wasn't. And so what she's saying is that lots of us who are darker skinned like myself, we think that, well, I'm out in the sun, I'm getting sun, so I must not have vitamin D. But there's some evidence that shows that maybe your conversion of vitamin D into the form that you need may not be optimal in people who are of darker skins. That might be the reason why. And then, do you eat a lot of fish or fatty fishes? Or
yes, I do. Yes, I like salmon, no sardines, but I do like tuna.
All right. So you eat a lot of the foods that vitamin D. So then what did your doctor do after that? What did they say that you should do?
She immediately put me on 50,000 units, which was kind of startling because I was at 1,000 units a day. So I'm like, 50,000 units?
That's a lot.
What's going on? Right.
Yeah.
And I began to take that once a week for 4 weeks. And then I went back in for more testing, and everything was normal.
Okay, so how long did you take that for, you said?
I did it for the first quarter. She broke me up into quarters. So I did it for the first quarter, then I went 1,000 units per day.
Okay.
Then I went back for more testing, and then when she saw that it would go down and up, it was like a roller coaster. She just put me back on 50,000 units again. Okay,
and because of the fact that it was not an appropriate level.
Right.
Again, the points we're trying to make is vitamin D. It's extremely easy to test for. And the treatment and replacement is very easy as well. So if you're intimidated or saying, you don't like to go see a doctor and they always do 1,000 things, this is a pretty simple thing. Yeah, I know for you the taking of the blood and the needles are hard, but compared to other things you need to do, it's relatively simple. So the idea is that if you suspect from listening to what we had to say, that if you could be at risk for vitamin D deficiency, that's an easy thing to check for and easy to treat. So I wouldn't put it off, don't be intimidated, and think that it's not something that could affect me. And in fact, we talk about that it's a sunshine vitamin, but for you, even though you were in the sun, it wasn't enough. So there's more to the story than just meets the eye, and so you have to keep that in mind. With many other many conditions like this, other vitamin deficiencies, you have to remember that not everything is what meets the eye. So see your doctor, and the testing may be as simple as a blood test. So we'll talk more about this. We have to take a break. When we come back, more with Catrina and treatment of vitamin D deficiency. Please don't go away. And you know, sometimes, you know, we take medicines and it takes a little while to work, so we get a little disheartened. How long does it take for you to get these symptoms better? Not gone completely, but better. Welcome back. When we left, we were talking with Catrina about her vitamin D deficiency. One thing I want to ask you, I know you were having some joint pains. How much did it affect your life? I know it was a nuisance, but did it actually affect your life?
It really affected it because I wasn't one that was used to taking medication. So the 50,000 units, I had to remember for the first 2 weeks, oh, I have to take this. But after I took it, I felt better. So I wanted to keep taking something to make me feel that way.
But what did you do before the vitamin D replacement for the joint pain, the muscle aches? Were you taking medicine for that?
No, I wasn't. Nothing? I was raised never to really take any medicine. My mother always told me to drink some cold water and pray. And it worked. I guess it's a mind thing. So that's what I would do for years.
That's great, though.
So it worked.
What you're saying, the idea is don't take medicine unnecessarily.
Unnecessarily, right.
But I guess, was it so bad that was it actually getting to the point where it was affecting your daily life?
Yes, it was. It was hard for me to interact with the children at the daycare, as well as sleeping was. I could only sleep on one side of my body for the joint pain, but then the muscle spasms on the other leg. So I was kind of going back and forth.
And it's important, you know, for those of you who've never experienced this, that, you know, we live in an era where everything is fortified with vitamins, and we don't really know what it used to be for our forefathers and you know, thousands of years ago, where, you know, one vitamin deficiency could really kill you. And so, you know, it's important to understand that if you don't have the right vitamins, what can happen. Right. Now, when you just saw your regular doctor, did you have to see any specialists at all for this?
No, I didn't have to go to another specialist. She's a family physician, so she kind of just tackled it. She pinpointed it out. That's what really kind of surprised me.
Yeah.
You know, as soon as I told her, she's an older doctor, and that's why I found her. She was very wise in that, and she told me, hey, you have something wrong. And when she did the test immediately, I knew that she had pinpointed what was wrong.
Perfect. And some people, and again, for those of you who are watching, you know, if your regular doctor, as good as they may be, if they're giving you vitamin D or whatever the case may be, you know, giving you supplementation and it's not working and you're still feeling the same as you did before, you can see a specialist. You know, an endocrinologist would be somebody you could see who's a specialist, but you didn't have to. That's great. Oh. And you know, sometimes, you know, we take medicines and it takes a little while to work, so we get a little disheartened. How long did it take for you to get these symptoms better? Not gone completely, but better.
Within 24 hours,
wow.
I immediately felt better. I could tell the difference. I would also forgot to tell you, I felt fatigued. I felt really tired sometimes, and I would get enough rest, but I just still felt drained. And that's how she also pinpointed it was my vitamin D. And within 24 hours after taking the first 50,000 units, my energy was back to normal. I was running again. My legs were okay.
Oh, so it was so bad you stopped running?
Yes. Well, yes. I'm not like I was running on a treadmill every day, but, you know, as far as my daily chores that I would have to do with the children.
I see what you're saying.
Yes,
Got it.
I could,
just your running around.
Just my running around, yes.
Got it. Okay, perfect. And then once you got treated with the 50,000 units, you start feeling better right away. And then did she get you back down to
to
how much again? You said 1,000?
Just 1,000.
And you're still taking that?
Yes.
Okay.
Yes, I'm still eating right. I'm eating better.
And in what way? Tell us about that.
At first, I can say, even though I'm small, I like to eat. I eat all day, every day. I don't know where it goes, but
well, you do a lot with your kids.
Yes, I guess I have a high metabolism, but. So now I'm eating, like I say, more fish. I'm trying the yogurt with granola.
Good.
You know, trying to just add more things with vitamin D in it. Eating more dairy. Just have to fight through it with the lactose. But, you know, I'm just trying to do better.
You can take lactate tablets too. I don't know if you've seen those.
Yes.
But if you take lactate tablets with it, I think it'll help. And for milk, there's soy milk as well. And alternatives, you can. I know you don't love it, but if you need to. For those of you at home, you know, don't. Again, it's your approach. You know, if you have a problem, you can have a barrier. You overcome the barrier, try to do anything you can. And there's so many alternatives out there now. And if you're lactose intolerant, you can take the lactate tablets, or there's alternative types of milk. So there are things you're doing. And it's great. She's being an advocate and she's being proactive, you know, taking more fish, do everything you can along with the supplementation. You know, so the treatment, would you say it was very easy or was it difficult?
It was very easy.
Yeah.
It was easier than I thought. You know, at first when you first of all, you have to get a call from a doctor. The results, that just kind of
you get scared.
You get kind of scared. Yeah. And she was just very nice about the whole thing, and it just worked out, you know. And I'm glad that I did go see her, and I'm glad I stuck with it, because I'm not good at swallowing pills. Like, I don't take medicine. That cold water works, but the vitamin D, I'm glad it's under control now.
Okay. And how is it affecting your life today? Is it affecting your life at all? The deficiency.
The deficiency. I'm better today, much better today. I can tell, like, someday if I skip a unit, if I may forget.
You're tired?
I'm tired, or I could start feeling that joint pain. So I say, you know what, let me stay on it, so that way it won't fall as low as it was.
You're pretty sensitive.
Yes.
Interesting.
Very.
The thing is also, it may be useful to find out, I know you don't see a specialist, but to see, because you're doing all the right things, why is it that you still need supplementation? You're taking foods that are rich in vitamin D, and then also you're in the sun, you know, enough, even though, you know, some of us who are darker skinned it may not be as effective, but it may be worthwhile for you to see a specialist to see, you know, exactly what's going on, why you need a supplement. Now, lastly, you know, you've been through this and a lot of people have not. What would you tell America and maybe the rest of the world about vitamin D deficiency and your experience with it?
To do some research on it, as well as, because as soon as she said it, I went home and started to Google
it.
I was Googling, Binging everything, trying to figure out what's wrong, why this happened, and even to know that in the future, osteoporosis and different things can happen if you don't have enough. So that's why I really got, you know, that's what I really want to take and stay on top of it. So just to know your body. Don't be afraid to talk to your doctor, and don't be afraid to ask questions.
Great advice. Thank you very much. Katrina, thank you very much for all the advice and sharing your experience. No problem at all. When we come back, we'll have our endocrinologist, Dr. Abdul Al-Kassab, giving us more information on vitamin D. Please don't go away.
The sunlight, the ultraviolet rays in the sunlight are being filtered by the ozone layer that's surrounding the Earth.
Sure.
And that tends to affect the ability of the skin to convert vitamin D.
Welcome back, and thanks for staying with us. We now have Dr. Al-Kassab. Dr. Al-Kassab, thank you for joining us today.
Thank you for having me.
You know, we're talking a little bit about vitamin D deficiency. You know, it seems like vitamin D deficiency is increasing, you know, in America, and is it in your practice as well?
Absolutely. I think we are seeing an increase in the level of vitamin D deficiency in the population of people and patients that we see.
Okay, and is it geographic, meaning that it's just certain parts of the country? Like, for example, California or places where maybe you get more sun, is it less so there?
I don't think so. I think the statistics show that all over the country there is an increase in the level of vitamin D deficiency.
Yeah.
So, and there are multiple reasons for that.
Yeah, and the thing is, you know, we live right now in Michigan, in a part of the world where we don't always see sunshine, and you know, in the winter months, all of us, you know, hibernate inside of our houses. We don't get much sunshine, so you know, a lot of us feel like it's because of that. But you're saying that even in places where there's sunshine, you know, readily available, and why is it? Let's talk about America first. Why do you think it's more prevalent here now?
Well, there are a number of reasons. Part of it is the diet that we eat. Although it's fortified with vitamin D, we know now that the levels that need to be taken every day are higher than what is in the common diet.
Recommended.
The second issue is the exposure to sunlight, like you said, but the ultraviolet radiation, where the vitamin D hits the skin and changes to the active form, is being filtered by the ozone. So although we are exposing to the sun, we are not necessarily getting the conversion that we need. And of course, sometimes people don't absorb the vitamin well, and obesity is a common cause that can cause to vitamin D deficiency.
Let's talk about, you know, so he said multiple reasons why the vitamin D deficiency exists. Let's talk about the ozone layer. So you're saying that the ultraviolet rays that actually reach that you need to have the conversion is actually altered in some way.
Absolutely.
Yeah, tell us a little bit about that.
Well, it seems like there is research showing that although you're getting the sunlight, the ultraviolet rays in the sunlight are being filtered by the ozone layer that's surrounding the Earth.
Sure.
And that tends to affect the ability of the skin to convert vitamin D. And there is some data to support that view, and that is part of the reason why, although you are living in an area where there's exposure to sun, there is not enough vitamin D hitting your skin.
Interesting. And then how about obesity? How is that playing a role in the lack of absorption of vitamin D or being deficient?
Well, I mean, part of the reason, of course, as our body size increase, our needs for vitamin D increase as well.
I see.
And also being a fat-soluble vitamin, it will be trapped in the fat tissue and not become available to the tissues. That may be another explanation that what we see.
Interesting. You know, a lot of people don't talk about this, but if you're obese, remember, so there's vitamin A, D, E, and K. They're fat-soluble vitamins, and vitamin D, we call it the distribution. Actually, if there's more fat in the body in one individual versus another, the vitamin D gets trapped and not used, and maybe you need more of a dose. That's very exciting. That's very interesting, rather. But what about the rest of the world? What's happening there? Are the same causes causing the deficiency in the rest of the world, where people, even agricultural societies?
Well, yes, but I think still that is a matter of supply. Most of the diets all over the world are not necessarily supplemented with vitamin D, and therefore there's a lack of intake in this population. And malabsorption can be another, which is an ability to absorb the food and the vitamin D particularly, because it requires fat, it requires certain chemicals in the stomach and in the digestive system to be able to process it. So I think that will be probably more worldwide cause of vitamin D deficiency.
Meaning that the actual intake of vitamin D and not having enough resources basically to have in certain areas of the world. Are there certain areas of the world that are more prone that you can think of outside the U.S.?
Well, like we said, the areas where there is not much exposure to sunlight, areas that are kind of having long winters, you would expect that there is more vitamin D deficiency, and that's what the statistics show as well.
Perfect. And so if you're in these areas that are prone, like Dr. Al-Kassab is saying, please see your doctor, even if you have subtle symptoms, or even if you have no symptoms, because sometimes it can be very difficult to diagnose. Which leads to the next question: why is it so difficult to diagnose vitamin D deficiency? Lots of us know about it as physicians. It seems like people go underdiagnosed or undiagnosed for quite some time. What do you think?
Because I think the symptoms of vitamin D deficiency can be brushed aside by the patient and by the physician alike as being stress, as being joint pain, as being arthritis, and that is why, because the symptoms can overlap with many other things.
Sure.
We tend to not think of this first, while it is something that's easy to recognize, and once you think about it, of course, you can do the appropriate testing. But part of the reason, because the presentation can be over a very long period of time and can be brushed aside as common stress or joint conditions. That
we're all tired too, and it seems like we're all on the go. So a very important point that Dr. Al-Kassab is making is that the symptoms are very non-specific, and often we think it's because of this, that, and the other. It's almost that if you're in areas that are more risk, almost you wonder if we should just start screening them irrespective of symptoms, if the test is cost effective, meaning that if the test is less expensive than having somebody who's having fatigue, their work efficiency is less and their quality of life is less. So if you again are in areas that are in the United States or abroad that are at risk, you should definitely get tested. And the testing is simple. And if you're a healthcare practitioner, if you're a physician or somebody who sees patients, be more vigilant, meaning be suspected, more so we can diagnose it earlier. Now we have to take a break. When we come back, we'll talk more with Dr. Al-Kassab. Please don't go away.
The vast majority of people can be managed by using over-the-counter products of vitamin D with the supervision of their doctor, depending on the degree of deficiency.
Welcome back again. We left you, we were talking about vitamin D deficiency with Dr. Al-Kassab. Dr. Al-Kassab, I don't know if you had a chance to catch Catrina Hurst. She came in and talked to us about her experience. Did you listen?
Yeah, I listened very carefully, and it's an amazing story, and that shows the typical presentation of vitamin D. How can it be easily missed in the form of joint pain to the point of making the patient not able to walk or function? And that's one of the important lessons that we hear from this story, that don't brush aside symptoms that can be easily misdiagnosed as arthritis or stress or pain or back pain or anything like that. That's an amazing story.
But what about, absolutely, I agree with you, because if you think of something simple like a vitamin deficiency can cause so much, and we take it for granted how much all of our foods are fortified with it. But what about a couple of other features? Number one is, dark-skinned individuals like myself and Catrina. What about the conversion of vitamin D into the active form in the skin. Any thoughts about that?
Absolutely. I think people who are dark-skinned, myself included, of course, and like you mentioned, a lot of the population are unable to process the conversion in the same way like the white-skinned people are. And therefore, although they are exposed to the sun, and that gives them the false security that they are getting enough vitamin D from the exposure, in reality, that's not happening.
And is it because the melanin? Is it doing something to not absorb the ultraviolet rays?
I think the melanin and melatonin and the cover and this skin color itself, it seems that it interferes with the chemical process that's needed to convert the vitamin D to the active form that the body needs to use.
Yeah, I think that it's an important point. A lot of us who are watching at home may be dark-skinned like myself and with all the people we mentioned. And not that we single those folks out, but you may be especially at risk, especially if you are a dark-skinned person in a place that's deprived of sunlight, and it's important to suspect that and test for it. So now, what about the fact that she felt so good so quickly? I mean, is that very typical of the joint pains, the muscle aches to feel instantly better, or is it more gradual in most people?
Well, it depends on the degree of severity. If you have a very severe deficiency like Catrina had, it is likely that once you saturate the body with a large dose of vitamin D like she did, she will feel quite quickly much better. And whether it's 24 hours or a little longer, it depends on the person. But it is a true thing because the body was so hungry for vitamin D. Once you expose it to vitamin D, the benefit starts right away.
That's great. So if you're somebody who's thinking that, oh, I've taken this for a long time before I have any improvement, because that happens with lots of our medicines that we give, it's not true. It's actually that you could feel just like Catrina. I mean, pretty quickly you can feel a lot better. Now you have a person with vitamin D deficiency like Catrina. What's your general approach when you see them? But by the way, we should let the viewers know at home is that Dr. Al-Kassab is a specialist. He's an endocrinologist. So by the time he's seeing most of his patients, they may have already been tried to be treated by a general doctor. So when you see them, what is your general approach?
Yeah, the vast majority of people can be managed by using over-the-counter products of vitamin D with the supervision of their doctor, depending on the degree of deficiency. And like you alluded to, the blood test shows and categorizes people to whether they have severe or mild deficiency. The vast majority of people can be managed with over-the-counter products, and that your doctor can determine whether you need 1,000 or 2,000 or even 4,000 or 5,000. These are all over-the-counter products. Sometimes we give a large dose, like what happened with Catrina, over a period of time. Typically it's 3 months, and that's to replenish the depleted stores of vitamin D in the body, and then we follow that by a maintenance dose of a daily vitamin D regimen over the counter.
And that replacement of the depleted stores is usually once a week, is it not?
Usually once a week, because it's a large dose, and typically the 50,000 that Catrina mentioned, it's a prescription dose, so the doctor has to prescribe it for you, and then you use it over a 3 months period, typically, sometimes 1 month, sometimes 2 months, but a typical dose is 3 months, 12 weeks, and then you follow that with a daily maintenance dose.
So it seems like, if you are diagnosed, that you can treat it, and you said the treatment lasts for several months. Now, with her case, it seems like she's doing everything right. I mean, she's now supplementing her diet with these foods. She's in the sun, albeit she's dark skinned. I mean, is there a reason why she still needs supplementation? She's, quite a long time since she was diagnosed with deficiency. What about that? I mean, what's going on with her?
Well, I think with the degree of insufficiency and deficiency that we have in the country and worldwide, my recommendation is to continue lifelong with vitamin D deficiency, with vitamin D replacement, unless there is any specific reason not to, because of the fact, like we mentioned, why did the deficiency happen in the first place?
Right.
Although it's in the diet, although it's in the skin, there are some factors that we don't fully understand. Therefore, I think I recommend that it's a long-term process, and because it's an over-the-counter vitamin and it's relatively low cost, I think I would recommend taking it until your doctor tells you otherwise.
Now, we will allude to this probably at another time, but I mean, is there a danger? We don't have much time, but is there any danger of toxicity if you have somebody who's now taking fatty fish, who's doing everything right, taking, never drank milk and didn't take dairy products, doing all that, and then take an over-the-counter dose? Is it a problematic thing to danger toxicity?
In theory, overdose of vitamin D is possible, and certainly absolutely can cause problems. But in the common doses that we have, it's very unlikely that these things is going to happen. So while on the other hand, you need to be supervised by your doctor, you don't want to miss the opportunity of taking enough vitamin D.
Perfect, very great advice. So again, even if you have done all the things that Catrina did, and you may need to take something lifelong. Great advice. Thank you very much, Dr. Al-Kassab. When we come back, we'll have questions from our studio audience. Please don't go away. Are the over-the-counter supplements safe enough that you can just start supplementing yourself, or would you recommend not doing that?
A general safe level is to take 1,000 to 2,000 of vitamin D every day.
Welcome back. It's now time to take some questions from our studio audience. Are you ready, Dr. Al-Kassab?
Absolutely.
Thank you. Yes, please.
Hi.
Hi.
Are vegans at high risk for vitamin D deficiency?
That's a great question. We talked about earlier that maybe vegans will not have enough dietary sources of vitamin D. What do you think, Dr. Al-Kassab?
Well, vitamin D is a fat-soluble vitamin, and vegan diet generally are low in this kind of vitamins.
Yeah.
So I think they are absolutely at a high risk of vitamin D deficiency, and I do recommend taking supplements in these type of situations.
But let's say food for thought. There are certain cultures that have survived for centuries with vegetarian diets and some vegan diets. What have they done? Have they just been deficient? I mean, is it possible to have a vegan diet and still, with adequate sunlight, be able to compensate for that?
I think so. I think over the centuries, as I said, the issue of the ozone layer and the absorption of the skin, like we mentioned earlier. So I think there is a possibility that vegan diet can still supplement vitamin D from the atmosphere. But in general, current vegan diets, we do recommend that they take supplements.
And so it's great advice. The thing is that there are a lot of benefits of vegan diets, and we'll talk about it in a future show. But the fact is, what we're talking about is maybe not absolute risk, but if you are at risk, whether it's a vegan diet, whether you're in a place where there's not enough sunshine, be proactive. Absolutely. Be proactive and then talk to your doctor. Now, would you say with the vegan diet, would you check the vitamin D level or just go ahead and start supplementing?
I do recommend checking the vitamin D level because it's more cost effective to zoom in on this vulnerable population. And then depending on the result, you can give the advice to the patient in a customized way.
I see. So, even though with the vegan diet, the chances are, much higher than with somebody who's not, like myself, now with the vegan diet, you should still check the vitamin D level. If you're in a place where you cannot, are the over-the-counter supplements safe enough that you can just start supplementing yourself, or would you recommend not doing that?
No, I think that they are safe enough because that's why the FDA allowed them to be unrestricted over-the-counter. A general safe level is to take 1,000 to 2,000 of vitamin D every day. Even if you drink milk, even if you take dairy products, you cannot overdose yourself that way. And at the same time, you have enough to, in case you are deficient, to boost your levels.
And there's some also products that vegans may eat, such as mushrooms or alfalfa, that also have some vitamin D. Correct. So you may be able to work that way. Thank you. Yeah, next question. Yes, sir.
Hello.
Hi.
I have Crohn's disease and I also have a vitamin D deficiency. What ways can I take replacement vitamin D?
That's a great question. So it's a good question because Crohn's disease decreases the absorption of certain nutrients, including certain vitamins. And so what do you think about this, Dr. Al-Kassab? What do you think is going on here?
That is one of the situations where we do recommend taking the high dose of vitamin D on a persistent and regular basis, more than the 3 months period, because in Crohn's disease, the absorption of vitamin D is compromised and impaired. And therefore, as a way to overcome that, we give a larger dose, assuming that there will be a big waste in there, and what remains to be absorbed will be adequate to replace the levels. So that's a great question, and we see that from time to time, whether people have Crohn's disease or, for that matter, have a bariatric surgery, because this is a situation where vitamin D absorption is impaired. We recommend high doses for a longer period of time.
Absolutely, great advice. The key also is that, Crohn's disease that's active, I treat Crohn's disease, and lots of my patients say, I feel fine. Why should I take this medicine or why should I take this remedy? It's because sometimes these problems are silent. It may not be enough to give you horrific pain or some symptoms of horrible diarrhea, but the lining of the small intestine, if it's damaged, then it will not absorb the vitamins. But if you take medicine, you control the Crohn's disease, and you decrease the irritation, and the ulceration and the disease, you also have a good chance of being able to absorb your vitamin D and other nutrients. That doesn't mean that you don't supplement if you need to, but the fact is that even if you have Crohn's disease, you still have a good opportunity with current medicines to heal it, and it's a good reason why you should keep taking your medicines, despite the fact that you may feel quote unquote good. We have to take a break. We'll have more questions when we come back. Please don't go away.
How much vitamin D does a normal adult need?
Welcome back, and thanks for staying with us. When we left you, we were answering some questions about vitamin D deficiency. Yes, sir.
I have a neighbor who has kidney problems and a vitamin D deficiency. Is there a connection between the kidney disease and vitamin D?
Yeah, there definitely is. That's a good question. There definitely is, because you need the kidneys to actually get the vitamin D to a state that is more efficient. Dr. Al-Kassab, what do you think about that?
Yeah, and I think that's also a great question. Vitamin D, as we mentioned earlier, it has a complex way to be metabolized, to be broken in the body, to be active. So people with kidney disease cannot activate the vitamin D that commonly comes from the food and from the sun, or even from supplements. So we have to use a special prescription active form of vitamin D in this type of situation. So people with kidney disease are more prone to have vitamin D deficiency, absolutely, because they cannot function that way.
And so what about the kidneys, and what is actually present in kidney disease that's not present in kidney disease that makes people not be able to have the vitamin D that's useful?
Well, the kidney has an enzyme, a specific enzyme that converts vitamin D to the active form. In other words, from what we call the vitamin D3 to the active form of it. And that enzyme is missing in people with kidney failure and kidney function impairment. And that's why we need to be able to provide them with a special kind of vitamin D to substitute for that missing enzyme.
Most the patients who are seeing kidney specialists will know that, but sometimes your kidney disease may not be so severe that you're seeing a kidney doctor. If your kidneys are not functioning well, even if you're seeing a general doctor, it's important to check the vitamin D levels. And it's tricky because your vitamin D levels may be normal, but the active form may not be there. So it's an important point. Our next question. Yes, sir.
Hello, doctors.
Hi.
Do people with dark skin really have lower levels of vitamin D, and why?
We touched based on that with Catrina. And it seems like we, dark-skinned individuals, can't metabolize the vitamin D in such a way. Dr. Al-Kassab, can you comment again like you did before?
And I think we have to be careful also, although that's the general mechanism, we have to understand that people vary in their ability, and therefore not every dark-skinned person will have automatically vitamin D deficiency. They are more prone to do, and I would say that these are the people who should be screened and more kind of in tune of trying to be replacing vitamin D. The mechanism is because the skin itself sometimes does not do that conversion in people with dark skin because of the darker color. You cannot absorb the sunlight to the right way so that the vitamin D will be actively changed into the form that the body needs.
And the melanin that you have may interfere with that vitamin D absorption. Again, another. If you're in part of the world, if you're watching this and you have in the majority of your population is dark skin, it's important to get screened, and it's important also, if you have the ability to get vitamin D in your skin, then your dietary supplementation or your dietary sources of vitamin D doesn't have to be as high as somebody who is doing it. So you have to kind of look at it in that way, that if I'm at risk, then my diet has to be that much better, because like I said, there's two sources of having vitamin D. So if you are at risk with having a person or your population's a dark skin, then even if you're in that country as part of a general screening test, I think you should test, and also make sure you stress that the requirements for vitamin D that's taken orally or without supplementation should be higher.
Correct.
So, yes, next question, sir.
Doctors, how much vitamin D does a normal adult need?
Yeah, what do you think in the U.S., with our diverse population? What would be the answer to that, Dr. Al-Kassab?
Well, the official recommendation from the Food and Drug Administration is a minimum of 800 units per day. But many experts believe that this is an underestimate of the needs. So I always tell people a minimum of 1,000, preferably 1,200 to 1,500 of vitamin D. And it's being widely available now over the counter. So I think 1,000 is a good number to remember and to supplement the diet with.
You know, and if you can, my philosophy is, again, supplementation is not expensive and it's easily available. It's over the counter, so if you can do it. But if you can do it in your diet, I prefer that. I always tell my patients, if there's something you can do in your diet before you can do a supplement's always good. And what are some of the sources? We talked about it, Dr. Al-Kassab, but what are some of the sources that somebody can get rich sources of vitamin D?
Well, all the dairy products, obviously, milk is fortified with vitamin D. All the cereal now is fortified with vitamin D. All the other dairy products, cheese, butter, all of that has vitamin D in it. Like you mentioned, the green leafy vegetables, mushrooms. These are the...
I love mushrooms.
These are the general good sources of vitamin D, but it's a fat-soluble vitamin, so anything revolving around fat is required for the absorption. So that's where most of liver, for example, as you mentioned earlier, that will be another source of vitamin D, although many people don't necessarily eat
liver, liver and onions. Not everybody likes that, but I do. But also salmon, fatty fishes.
Absolutely.
And if you love, grilling salmon, and if you like fatty fishes, that's a great source, and it's relatively healthy. So, the thing is that if you can be educated and try to find sources that, besides just taking a pill, that you can incorporate in your daily routine. And also what's important is that teach your children, because when they're young, it's unbelievable how much you can teach them that stays with them the rest of their life.
Absolutely.
And it's not going to get any better. I mean, the ozone layer is not going to change for the better. It's going to be the same problems that we're having now. So teach your children, tell them what sources there are of vitamin D that they can take, every day. And I think that if we do that, I think we can solve this problem. So Dr. Al-Kassab, thank you so much for taking the time to answer these questions. No problem at all. Please don't go away. When we come back, we'll have Partha's prescriptions. Thank you. Welcome back, and thanks for staying with us. Today, we've discussed vitamin D deficiency affecting billions worldwide. Now, what can we take away on today's Partha's prescriptions? Number one, be proactive. If you have signs suggestive of vitamin D deficiency, please see your doctor to get tested. It could significantly improve your life. Number two, be informed. Know which foods provide adequate vitamin D for a healthy life. Number three, limited sun exposure may be useful for adequate levels of vitamin D. Due to other risks associated with sun exposure, please consult with your physician. Number four, please be careful. Too much vitamin D can be harmful. Don't take supplements without the supervision of your physician. For more information on vitamin D deficiency or an archive of our previous topics, please visit our website at www.askdrnandi.com. And remember, you can join the discussion on our Facebook and Twitter pages. Just search Ask Dr. Nandi. Now lastly, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. And that word is namaste. So namaste to each and every one of you, and thank you for watching. See you next time.